We're excited to announce that our podcast, The Table with Renee Da Silva, is evolving. We're introducing 3 new streams of content on this podcast, designed for Health System CXOs and hosted by the Health Management Academy's subject matter experts for health system nurse executives, health equity officers, and strategy executives. With this change, we'll be activating health system leaders towards outcomes and scalable solutions you can implement now. Welcome to the Health System CXO podcast, featuring 3 streams of content designed for health system nurse executives, health equity officers, and strategy executives. I'm Jasmaine McClain, Executive Director at the Health Management Academy and Health Equity Officers host. And together, we'll explore equity in plain language and assist you as you navigate the complex structural challenges associated with system transformation and health disparities. The question of the day: in this complex, crowded healthcare ecosystem, which health systems are actually moving the needle on health disparities? My hope is that across the next few episodes of this podcast, that we can talk about equity in plain language among us. How do the best CXOs embed equity as a lens on every aspect of health system operations, rather than a siloed side project that's vulnerable to the changing tides of our political climate in the United States? Our Health Equity Alliance team at the Health Management Academy spends day in and day out supporting health equity executives at leading health systems across the country. So over time, we've gotten pretty good at knowing what to look for and listen for to quickly understand how an organization is approaching health equity as a system-wide transformation effort. And I want to talk about that today. I have 5 hallmarks of committed systems that come to mind for me, and I also want to share some concrete examples of health systems who are embodying these hallmarks in the way that they approach their work across the system. It's so easy, and I hear this all the time, to get jaded in how slowly the work seems to be moving relative to the sense of urgency that a lot of us feel who are deeply invested in the health and the well-being of our communities. I do consider myself, though, to be somewhat of an aggressive optimist, and I think it's mission critical for all of us to spotlight the organizations that are striving to make change. So I have a few ideas to share. I'd love to hear what you have to add. Let's jump in. Hallmark number 1, do you have a curious, community-oriented board? For years, our research teams have been studying how the most effective not-for-profit health system boards compare and contrast their approaches with those that are taken by S&P 500 companies, for example. Certainly, we're seeing shifts in the type of professional skills that leading health systems are seeking in their board members, from technology expertise to consumer experience and more. One of the most interesting shifts for me in our work around health equity has been how system-level boards identify and engage with trusted community leaders to ensure that their priorities actually resonate with the communities that they serve. The example I'll share here is Christiana Care, based in Wilmington, Delaware. They've been a real star in so many ways, in board leadership, in activating in local communities. We interviewed several members of their board and their leadership team a few months back to understand how they're leveraging community expertise to lead from the front. And in the conversation, I loved hearing board member Logan Herring's take on how his connections as a Wilmington native have helped the board to surface potential missteps and engage in communities in a different way. New programs or partnerships, particularly those that are focused on health equity, don't always land. And it's important to have a board and a leadership team that can continue to refine along the way by asking good questions and by checking in with a range of community members. Hallmark number 2, does your health system invite public-facing accountability? Now, this is not just the accountability that's shrouded behind paywalls and payment models and regulatory confusion. This is a version of accountability that you could easily explain to your mom. So for example, Providence, headquartered in Renton, Washington, with 51 hospitals across 7 states, announced a $50 million commitment specifically focused on advancing health equity back in 2020. And the intent was to have this commitment across a 5-year time period. For many of us, that number alone was huge. It signaled a focus, a drive to really advance outcomes across the communities that Providence serves. But one of the things that I've been really interested in following is the system's public-facing health equity progress report. Anyone can Google Providence Health Equity Progress and read a regularly updated report on the number of patients the system has served, how they're tracking against that $50 million commitment, and much more. So I love this, and I particularly love the ease of following the money as a form of accountability. One bonus example that I might share here is from Corewell Health, headquartered in Grand Rapids, Michigan. Corewell Health has been a true leader across the state of Michigan and beyond in so many ways. But one that I'll call out is the system's effort to develop and refine a set of metrics that can be used to measure trust in partnership with community leaders, not just within the system. Corewell hasn't stopped at creating these metrics, but they continue to execute a system-wide strategy that has trust at the core. Tina Fries-Decker here, as CEO, has led the charge in partnership with a remarkably committed leadership team. So we've been excited to watch them. Hallmark number 3, do you have a C-suite Justice League? And shout out to Brian Buckley from NCQA for this term. We know that you cannot rely on your health equity leader alone to do health equity, quote, for their organization. It's a team sport. Unfortunately, we've seen too many examples of organizations relying on a single leader or an under-resourced team to drive equitable outcomes across the organization. This does not work. For me, a great example of an organization that is doing the work with a C-suite Justice League is Virtua Health out of Marlton, New Jersey. Virtua is working across South Jersey to engage everyone. This includes patients, communities, and team members, and they do this through the lens of dignity and resource-smart innovation. There's so many executives I could spotlight here. Dennis Pullen, as the CEO, really working to embed the values across the breadth of the organization. Deb Moran, who serves as SVP of Health Equity and Community Programs, partnering with thoughtful leaders across Virtua and beyond to advance community health. Stephanie Fendrick as EVP and Chief Strategy Officer, championing these commitments in Virtua strategy. The list goes on and on and on. So kudos to the Virtua team for this Justice League approach. Hallmark number 4, do you have a CEO who learns in public? So I'll just take a pause here to underscore, I'm not sure why this is so hard. If anybody has thoughts on this, I would really love to hear it. What I know for sure is only a handful of CEOs have mastered the art of getting it right versus being right. One that I'll spotlight is Michael Dowling from Northwell Health, based in New York. Now, we could talk about Michael's public thought leadership or the many forward-thinking collaboratives that he's led in his tenure as CEO. But one of the things that I'm most struck by is how consistently Northwell's leadership team talks both publicly and privately about his commitment to shared learning as a leader. This has ripple effects on the type of talent that's attracted to the organization, the shared sense of accountability among decision makers, and the culture of continuous improvement. And so we'd love to see more CEOs who are getting good at learning in public. Hallmark number 5. Does your organization work to avoid the smart talk trap at all costs? Now, what is the smart talk trap? Simply put, it's when your organization is focused on saying something smart about health equity rather than doing something smart for patients, for communities, and for team members. In all honesty, I think the number of policy and regulatory shifts at both the national and the state level have made this hard for a lot of leaders. There's a ton of new terms, new metrics to keep track of, and folks are drowning in the language. But we actually have to keep focused on the next right thing that we're doing for patients and for communities, even if the language around it isn't yet perfect, because it'll probably never be perfect. I love Advent Health out of Florida's new service standards shared by CEO Terry Shaw. They're simple. Love me, own it, keep me safe, and make it easy. Those are not easy things to do, particularly at scale, but they're very easy things to say. In short, hallmark number 1, do you have a curious community-oriented board? Hallmark number 2, does your health system invite public-facing accountability? Hallmark number 3, do you have a C-suite Justice League? Hallmark number 4, do you have a CEO who learns in public? And hallmark number 5, does your organization work to avoid the smart talk trap at all costs? We'd love to hear what you have to add to this list. What do you disagree with? What would you want to know more about? We're always eager to hear your thoughts on this topic and others that you want to hear from us in this podcast. Reach out to us at equity@hmacademy.com with your feedback. I'll also make a quick plug for a recent report that we collaborated with the American Hospital Association and the Black Directors Health Equity Agenda on progressive health systems across the country who are leading in diversity, equity, inclusion, and health equity through their work with their boards. So we'll link to that report in the show notes, and we'd love to hear your feedback on the content. Thanks for listening, and we'll see you next time. Thank you for joining me on the Health System CXO podcast, where we activate health system leaders towards outcomes and scalable solutions you can implement now. Remember to subscribe to the Health System CXO podcast on your favorite podcast platform so you never miss an opportunity for insights. If you like this episode, consider leaving us a review and sharing our podcast with your friends and colleagues. You can also connect with us on LinkedIn by clicking the link in the episode description. See you next time.